Hi, my name is Jeanne Keenan from Watertown, Massachusetts. I'm the owner of the costume company in Arlington, Massachusetts. And I've owned my business. I'm self-employed, owned my business for 25 years. And thank you for this opportunity to talk about this issue, because it's pretty important to me and to a lot of other self-employed people I know. I pay $550 a month for Blue Cross Blue Shield. I just recently did get some supplemental help from the Commonwealth of Massachusetts. My husband is a self-employed contractor, and he is out of work because of the circumstances, the economic circumstances right now, and he has a chronic condition of asthma. He cannot afford to pay for physician's bills or treatment or for prescriptions. He just today went to Walmart to see if he could get some kind of reduced price on the medication, and it was $200 a month. So he's been foregoing that medication for over a year now. I just recently had a very minor operation, and Blue Cross Blue Shield, because of my deductible and for other reasons. First of all, it cost me $25 to $40 per visit to go, copay. Then when I had the operation, which was very minor, here it is, I just got a bill for another $600 that was not paid by the provider. And then I also got an initial bill from a doctor I'd gone to see to diagnose this, and she actually diagnosed it incorrectly, and she charged me $200 more for for freezing something on my finger. So now I'm out. What does that come to? $800 more I owe in addition to what they covered. I guess it's one of my biggest expenses after my rent is my health care. And I'm in arrears right now, but they've been pretty nice about that. And it's always on my mind. It's always a problem. It's always a worry, and particularly for my husband. I don't know how I feel about about government providing health care. The only experience that I've had with it was I did have an incident in France when I was visiting there, and it was really great. I had an MRI. I was in 3 ambulances. I had some medication, and when I got home, I was charged $20. I didn't have to wait on any kind of long lines. I was treated very nicely. So that's my only experience with a government, government-supplied health care. So I don't really have any opinions yet. I'd like to see what is going to be put on the table. In addition, as I approach wanting to retire and to have a healthful and happy retirement life with my husband, I'm afraid. I think that I'm not sure how we can afford it. I don't see how we can stop working, and I think it's really a major, major concern for me and for my husband, and also for my friends and family, who mostly everyone I know is self-employed. And so and we're all around the same age too, and we don't want to be a burden to anyone, and because we're self-employed and we're independent people, we don't want to have to be relying on or be abandoned either. So it's a huge, constant worry that I hope can be relieved.
Have you looked into Medicare and what it offers, and if it's going to be legitimate for you guys as an option, or is it just I don't really know much about.
I just know that, like, my parents, who were hardworking blue-collar people, that they had AARP as a supplement, and then they had Medicare, and they were fairly happy with that. I don't recall, except that there was so much red tape and so much bureaucracy, and particularly as they got into their later years, it was difficult for them to manage that. So that's another concern and worry. So, and I think as you get older and get into that time of your life, you shouldn't have to deal with people putting you on hold, and red tape and filling out forms, and so that's another aspect to this whole, if it's government operated, you know. But And obviously, we don't want people at that point in their lives to have those kind of worries. You know, myself, and I don't want to have it for myself. So, yeah. And I haven't even talked about people who have no income or are poor or the working poor. It's you know, it's just a lot of people who are in need of that assistance. So, mainly, I just guess I like the fact that I'm having a chance to speak for the self-employed, because I think we're a forgotten population. That's about it. Thanks.